Hi, good afternoon, everyone. Thank you for joining us today for this webinar on Peptic Ulcer Diseases, Myths, Facts, and the Way Forward. My name is Fadira, and I'll be your host today. So, many of us might be wondering what is peptic ulcer? Peptic ulcer disease is a condition that affects many people worldwide, which is why we're talking about it today. And there are a lot of misconceptions surrounding it. So, today we're going to aim to separate the facts from fiction and explore the best way to manage and prevent this condition. Now, by my right here, I have Dr. Jagade Adedamola Oluwadamilare with us today. And Dr. Jagade is wonderful. She's a medical doctor and an alumni of the College of Medicine, University of Lagos. She had her internship at the same institution and youth service in Ebony State. She currently works with us here at KAAF. So lovely to have her. Welcome, Dr. Jagade.
Thank you so much. Good afternoon, everybody. It's my pleasure to be with us today. So, as she has rightly introduced, my name is Dr. Jagede and I work at KAAF Medical Center here. So, today we'll be talking about peptic ulcer disease. What are the myths, what are the facts, and what's the way forward as regards the treatment of peptic ulcer disease? So, I would like to start with, what exactly led to this topic. During the course of trying to pick what we're going to discuss today, we didn't just want to choose a topic out of the blues. We wanted something that would make an impact, something that would address the need of our immediate community. And I noticed that during the course of my interaction with patients, most people that come in with ulcer-like symptoms, most people come with different conceptions, different ideologies that they already have as regards what caused the ulcer and even the management. And most times I have to do like a counseling and a debriefing and, just to make people understand what it is and, what how we can navigate the treatment of ulcer. That's why we chose this topic. First of all, by way of definition, what is peptic ulcer disease? So first and foremost, an ulcer is simply a sore in the lining of the gastrointestinal tract. So an ulcer is a sore either in the stomach, in the or the esophagus. So just to make it very simple, just imagine you have a sore or your wound on your skin. So it's something similar that is going on in the stomach, that creates ulcer-like symptoms. So secondly, what causes peptic ulcer disease? There are a couple of things that can lead to peptic ulcer disease, but the most common cause of peptic ulcer disease is an infection with a bacteria that we call Helicobacter pylori. So this bacteria is spread via contaminated food and water. And most times, once people take in this bacteria, it goes into the gastrointestinal tract and destroys the mucous layer of the stomach, therefore causing this sores that will cause symptoms of peptic ulcer disease. Another thing that causes peptic ulcer disease is prolonged and indiscriminate use of a class of drugs that we call NSAIDs. Examples of these drugs are ibuprofen, diclofenac, aspirin. So these drugs, when you use them for a long period of time and in the wrong way, can make an individual to come down with ulcers. Another thing that causes ulcer, that predisposes one to ulcer, is smoking. And these are just different things that could cause peptic ulcer disease. So how would an individual that has PUD, that's the short name for peptic ulcer disease, so how would such a person present? So the commonest presentation most times in clinic is people who come in and they say they are having this burning, peppery sensation in the upper part of their abdomen. Some people come in feeling bloated. Some people come in feeling like their food is not digesting very well, and some have nausea, vomiting. So remember, I mentioned that an ulcer is a sore. So, and I also, by way of comparison, I mentioned that just imagine a sore on your skin. So, if you have a wound and it's not properly cared for, the wound would keep getting deeper and deeper. So it's the same thing with the stomach. So if it's not treated on time, it keeps getting deeper and then it can start bleeding. So at this point, some people will come in with vomiting of blood and seeing blood-like substances in their poo, and then for a few number of people, if it's still not well treated, remember the the gastrointestinal tract is hollow. So, there could now be a perforation in the stomach or wherever the ulcer is, and the contents of the stomach can spill to the abdomen. So, at this point, it becomes a medical emergency, So, you can see how something so simple can progress to become something that is very complex. So having said this, how do we now treat peptic ulcer disease? So, in the medical world generally, prevention is always better to prevent something than to treat it. So I would start from prevention before I now talk about, treatment. So since Helicobacter pylori, which is a bacteria that is spread via contaminated food and water, is the commonest cause of peptic ulcer disease. So that means that use of safe water and eating safe food is one way to prevent peptic ulcer disease. So you want to make sure you are cooking with clean water, you are drinking clean water. H. pylori can also spread via saliva of contaminated persons. So you want to make sure that, whatever you are putting in your mouth has been prepared under hygienic conditions. So another way of preventing, since remember I mentioned a class of drug called NSAIDs can cause peptic ulcer disease. So you want to avoid unnecessary or wrong use of this class of drugs. So you want to use them only when necessary, and you want to use them the right way, which is why as clinicians we always emphasize that whenever you are using these medications like ibuprofen, diclofenac, aspirin, they should be used with food. Don't exceed your dosage. Most people that use these medications, they are medications that are used for pain. So most people, imagine a drug is prescribed for just 3 times daily, and maybe the pain is so much, and you feel, this pain is so much, I can't just stick to 3 times daily. Some people can go as much as 8 times in a day, using the wrong dose. And, even though the pain might get better, but in the long run, you are damaging your GI tract. So one way to prevent peptic ulcer disease is to avoid wrong and indiscriminate use of NSAIDs. Now, aside from these two things that could cause peptic ulcer disease, there are certain predisposing factors, that can make one very likely of having a peptic ulcer disease. So meaning that if you avoid these things, you can avoid having an ulcer. For instance, smoking and indiscriminate use of alcohol. So, by avoiding this, you are protecting your gastrointestinal tract. Reason being that smoking and use of alcohol, it will cause inflammation, widespread inflammation, including the lining of your stomach. So this is why staying off these things will protect you. Now, okay, someone has come down with we've diagnosed peptic ulcer disease in a patient. How do we treat it? So we treat it by treating the exact cause. For instance, if it has been caused by an H. pylori infection, we treat by use of antibiotics. If it has been caused by prolonged and wrong use of non-steroidal anti-inflammatory drugs, we treat by removing the causative factor, which is stopping the use of those drugs. Now, this is just for simple cases of peptic ulcer disease. For the complicated forms of peptic ulcer disease, for instance, someone is bleeding or an individual has a perforation, they would require, more intensive and detailed treatment. Now to the very, interesting part of our discussion, which is the myths. What are the myths of peptic ulcer disease? What are these things I've noticed in clinical practice? There are quite a lot of misconceptions, wrong beliefs. One of them is that what I've explained, that a bacterial organism can actually be what is causing this peptic ulcer disease. Yes, H. pylori causes peptic ulcer disease, and it's preventable, it is very treatable. Another myth I noticed is that children can have peptic ulcer disease. A number of times parents bring their children, and this child is just having this recurrent upper abdominal pain, that they've done a lot of things and it's still not resolving. And I'm like, okay, let's do an H. pylori screen, let's rule out peptic ulcer disease. And parents are like, no, children can't have peptic ulcer disease. Yes, children can. If H. pylori is spread via contaminated food and water, a child can have it. If children can use NSAIDs, they can come down with peptic ulcer disease. And there are even a whole lot of other conditions that causes ulcer that can also affect children. Another common misconception is that what causes peptic ulcer disease is a bad appetite, meaning that people that tend not to eat well, tend not to eat regularly. While prolonged periods of fasting and staying off food for a while can worsen the symptoms of peptic ulcer disease, it's not the primary cause of peptic ulcer disease. So that's another common misconception I get most of the time. One very interesting one also is that, milk can alleviate the symptoms of ulcer. It is very false. While using milk lead to some transient relief, in the long run it doesn't benefit your gastrointestinal tract. And then one very important myth I have had also, which I would like to address, is that any form of upper abdominal peppery sensation in the upper abdomen is ulcer, is peptic ulcer disease. It is very wrong. There are a whole lot of other conditions that can cause what we call dyspepsia. That is the feeling of discomfort, pain, bloating in the upper abdomen. There are a whole lot of conditions that can cause those symptoms. And what I see some regularly in clinic is that people start having these symptoms and they are like, yes, I have ulcer. And a couple of times they don't get to the primary cause of the problem. For instance, I once had a patient that, we had treated H. pylori infection. We had even done an endoscopy and she was still having these symptoms. And we just did an abdominal scan and it showed an anatomical defect that predisposed her to having such pain, and which we had to address. So, peptic ulcer disease is just one of the many things that can go wrong in your gastrointestinal tract to cause dyspepsia. There are a whole lot of causes of, dyspepsia and ulcer-like symptoms. So I think I've come to the end of my presentation, but in summary, my take-home point is Helicobacter pylori is the commonest cause of peptic ulcer disease. And one way of preventing this is to drink safe water, cook with safe water, wash your hands regularly, especially after using the restroom. And secondly, peptic ulcer disease is not the only cause of dyspepsia. If you've been having regular or occasional feelings of discomfort in your upper abdomen, please go see your physician so that you can be properly investigated and treated. Thank you very much.
Thank you so much, Dr. Jagede. So I can imagine a lot of us has question, and this is just something that came up, and someone asked, aside medical treatments, what are the other things someone with peptic ulcer can do to reduce the frequency of symptoms?
All right, okay. So, well, aside the medical treatment, use of antibiotics, what are the other things that can be done to alleviate the symptoms of peptic ulcer disease? Okay, so, for people that are having symptoms of dyspepsia, this peppery sensation, most times we want to advise them to always eat food in little bits. So it's always better to eat food in little bits that the stomach can easily digest. Secondly, after eating, it's doesn't help if after eating, you immediately go lie down. It's always good to sit up, because lying down can cause a reflux, can just tamper with the normal process of digestion. So it's better to sit up, walk around after eating. Then, secondly, it's been noticed that different people have different trigger foods for peptic ulcer disease, and so if you know what commonly triggers you, stay off it. For some people with beans, so for some people it's foods that is very spicy, for some is fried foods. So stay off foods that trigger your symptoms. Yeah, so those are the little things that can be done to alleviate symptoms aside medications.
Okay. We have another question here, and I know you did answer it in your presentation, but someone here is asking, apart from peptic ulcer, what are the other things that can cause ulcer-like symptoms?
So, ulcer-like symptoms, which we term dyspepsia, can be caused by there are different things. For instance, there are some anatomical defects that can predispose one to having ulcer-like symptoms. For instance, the stomach, if the stomach goes, if for whatever reason the stomach is not where it's supposed to be, there can always be reflux of acid in the stomach to the upper part of your GI tract and cause ulcer-like symptoms. Then, secondly, there are some autoimmune conditions that can cause excessive production of acid in different parts of the GI tract and also cause ulcer-like symptoms. Yes, some other conditions, like for instance, gastric cancer, can also cause ulcer-like symptoms. And I'm sorry, I forgot to mention that peptic ulcer disease can even also progress to cause gastric cancer in some people if it's not addressed on time. Yeah, thank you.
So, I mean, and I'm loving all the questions that everybody is dropping on both YouTube, Zoom, and Instagram. So, someone here asked, for someone that has treated H. pylori and is still having the upper abdominal pain, what can the person do?
I think I mentioned something like this before. So let me address the process of diagnosis of peptic ulcer disease. I would like to emphasize that, the standard way of diagnosing peptic ulcer disease is actually what we call an endoscopy. So it's a procedure where they put a tube into your mouth, through your mouth into the stomach to visually see the lining of the intestinal tract. So, it's when we physically see that we now say, okay, this person has an established diagnosis of peptic ulcer disease. Now, however, because of how stressful and invasive that is, we don't always go straight to that. We start with an H. pylori test. If it's positive, we treat. If the person still has symptoms, we now go on to do an endoscopy. Now, addressing your question, apart from peptic ulcer disease, what? I'm sorry, I missed your question.
Sorry, this person has treated H. pylori and they still have upper abdominal pain. What can they do?
So if you treated an Helicobacter pylori infection, you're still having upper abdominal pain, please go back to your hospital to see your doctor. That means we need to do an endoscopy to pick the diagnosis. Then if it's still not peptic ulcer disease based on endoscopy, we need to explore other things causing the dyspepsia. Thank you.
So, I mean, amazing. And also come to our hospital, and Dr. Jagede would guide you very well on that. So, yeah, and this is just like my question to you, like as a doctor and with your research or anything. Are there like any emerging treatments or new therapies that show promise that you can share on peptic ulcer? I know we discussed in our preview yesterday, and you were telling me the history of how the doctor discovered peptic ulcer. If you like to share for that, it was a really interesting story. I'm sure that everybody wants to hear.
Okay, so well, it's a very interesting story. So, history has it that it was always taught, it was always taught that peptic ulcer disease was just due to corrosive substance. It was never linked to an Helicobacter pylori infection. However, there was a scientist that started finding a relationship between peptic ulcer disease and H. pylori infection. So he made the proposition, but nobody believed him. So what he did was that he deliberately infected his GI tract with H. pylori. And when they now did the diagnostic test for him, they now picked ulcer in his stomach. So that's the story of how someone broke the ice and established that H. pylori actually causes peptic ulcer disease. Now, coming to treatment, current treatment, emerging treatment, okay, so since Helicobacter pylori is the commonest cause, the first thing we do is to screen and use antibiotics if the test is positive. Then, secondly, we do endoscopy. Now, the good thing about endoscopy is that it is both a diagnostic and a therapeutic procedure, meaning that if we do an endoscopy and we visually see that, okay, there is an ulcer, there are interventions that can be done during the endoscopy to treat the ulcer and and just generally resolve the condition. Yes, so those are the current treatments. As regards imagine, I'm not aware of any. I just know of treatment of H. pylori infection and endoscopic therapeutic procedures.
Now, I think this is very important. What do you have to say about people that come up and say, oh, their stomach is peppering them, or oh, they take milk to relieve ulcer? I'm sure you've had patients that come with a lot of funny stories, and you're like, okay, this is not the medical. Can you share some lights on that? Basically, just share some, funny encounters you've had about patients coming to tell you that, oh, they take milk to relieve their ulcer, or their tummy is peppering them, or they eat pepper because they like it.
So if I get you correctly, you want real life scenarios of what I've encountered clinically. Well, there are a couple of them, but the commonest one is, a child comes in and I'm like, okay, let's screen for peptic ulcer disease, and it comes out positive, and the mother or father is like, I've told you, you don't eat. If I serve you lunch, you would keep picking at your food. Now you have ulcer and blah blah blah. And I just have to sit them down that it wasn't the not eating that caused peptic ulcer disease, or it's actually an infection, or they need to do an endoscopy. That's one. Another interesting one is I noticed is that which is actually quite concerning. I have people that have had dyspepsia for a very long period of time, and what I notice most people do, a lot of people, ulcer is like something we get from the that is something that is on the lips of most people. They are like, your stomach is paining you, you have ulcer. You've not been eating very well, you have ulcer. So most people even already know what to do in quotes, like once they start having these symptoms. So I noticed that most times, most people I've been having these symptoms for up to 10 years, if not more. And what they've just been doing is to take antacids, omeprazole for a very long period of time. And then they come into my office and they're like, doctor, some people even have the the boldness to tell me, doctor, see, this ulcer, this is how it presents, this is how it worries me in vernacular language. And they're like, see, just give me my omeprazole and Gascol, let me just go. And I'm like, okay, have you ever done an H. pylori screen? And they're like, no, what's that? And I'm like, it's a bacterial organism that causes, and they're like, so bacteria can cause this ulcer. And I just have to sit them down and explain to them. Another interesting one is, a couple of people keep on treating H. pylori infection and don't go on to have an endoscopy. Once you've treated H. pylori, you still have dyspeptic symptoms. Please see your doctor. Let them explore other possible causes, such as an endoscopy. Sometimes we need to call in the general surgeons and all. Okay, another interesting scenario, which we get to see most times in elderly people, because elderly people have these arthritis that can be very painful. So most times elderly people left on their own can use NSAIDs for a long period of time, the wrong dosage. So most times they come in with perforated peptic ulcer disease. Not to, I've not seen one here at KAAF, but while I was doing my internship at LUT, it was a common presentation. Perforated peptic ulcer disease, secondary to most likely prolonged use of NSAIDs, and at that point, it's a medical emergency. So those are interesting scenarios I've seen as regards peptic ulcer disease.
That's really interesting. That's actually really interesting. So I have a question here. Someone is asking, is peptic ulcer related to heartburn?
Okay. Is peptic ulcer disease related to heartburn? Now, as I said, there is an umbrella, would I call it an umbrella term to describe all these ulcer-like symptoms? We call it dyspepsia. So most times what people call heartburn is gastroesophageal reflux disease, meaning that for whatever reason, the lining of the entrance of the stomach is lax, so the acidic content can go up to the esophagus around where the heart is and cause a burning sensation. So peptic ulcer disease is not related to heartburn. They are two different things, but it can present in similar ways.
Now I know some people that have ulcer, they have specific dietary requirements or recommendation. I've heard people go as high as saying, oh, they switch to olive oil, or they don't take pepper again, or they take milk, or a lot of that. What? Because I know there's a lot of misconception about that. Can you recommend some dietary recommendation for people that have practice ulcer that could, you know, help them manage their lifestyle or to prevent it?
Well, actually, there is no strict dietary recommendation because, as I mentioned, the diet is not that's not the primary cause of the peptic ulcer disease. So saying that you want to go on a particular diet won't address the cause. The way forward is to address what's causing it and treat it. Now, there is no one size fits all. Different people have different trigger foods. So the way forward is to know, okay, what exactly triggers your symptoms and stay off it. I don't think there is any need to, take a particular strict diet. And of course, you should eat healthy fruits, vegetables, avoid junks. That applies to everybody. But there is no dietary recommendation or protocol that is peculiar to someone that has ulcer. You can eat what you want to eat, but once you notice that this thing triggers my symptoms, please stay off it. And common things that, as I mentioned earlier, that have been known to trigger ulcer-like symptoms, foods that are overly spicy, fried foods, for some people, beans and all that. Then, as I mentioned earlier, milk has nothing to do with ulcers treatment. It would create a short-term relief, but in the long term, it has no positive outcome in treating ulcer.
So, someone here is asking that they have an history of peptic ulcer in their family, and they've done screenings and they don't have ulcer. But due to their family history, how often should they go for follow-up appointment or screenings, and is this something they should be concerned about?
This person has had history of peptic ulcer disease in the family, so she wants to know how frequently she should go for a screen. Well, most times there's nothing like a routine screen. Most times is once you start having dyspepsia, once you start having dyspepsia, you go to the hospital and then we start the process of screening. You understand? So there's nothing like a routine screening. If you have the symptoms, you come in and then we take it up from there.
Now, so for the sake of this presentation, I went to Google and I saw some funny questions about peptic ulcer. And someone asked that, can they live forever with peptic ulcer? Can you shed more light for that? Can they live with it? They have it. They want to live with it.
Yes, of course. It's possible to have a very good, enjoyable life with peptic ulcer disease once it's properly treated. Once you stay off your trigger foods, yes, it's very possible to live with it comfortably.
I'm wondering, what are the dangers of living with the peptic ulcer if left untreated for a long time?
The question is if peptic ulcer disease is left untreated for a long time, what are the dangers? So I believe I had mentioned this before the sequel. So peptic ulcer disease can cause bleeding. So such individuals start vomiting blood and they would start to see blood in their stool. And if this occurs for a long period of time, it can lead to anemia, meaning the blood levels begin to drop. And then if the ulcer progresses, it could cause a perforation in the lining of the stomach or the esophagus, wherever it is. And this perforation can lead to leakage of the content of the stomach, in which case it becomes, an emergency. Then peptic ulcer disease, if left untreated for a very long time, that irritation of the lining of the stomach, can cause a cancerous transformation. So it can lead to gastric cancer in some people if left untreated for a very long period of time.
Now, I think this question is coming from an older person, and they've been having upper cramps. I know you mentioned something about older people. Maybe that's why the person came up. So they've been having the upper cramp. They've checked for ulcer. They don't have ulcer, and but they do confess that they've been using ibuprofen. So, what advice or what step would you recommend for this person to take? The person is just asking that what can they do? They have ulcer. They're in their older this thing, and yeah.
So my first question is, how exactly did you confirm that you don't have ulcer? As I mentioned, the standard way of diagnosing peptic ulcer disease is an endoscopy. So have you done an endoscopy to properly rule out peptic ulcer disease? Then if you've been using NSAIDs regularly, have you been using the right dose and the right way? So most times we emphasize that you use them, with meals. You don't use them on an empty stomach. So for now, I will advise safe use of the NSAIDs and please go to the hospital so that you can be properly screened for peptic ulcer disease. Thank you.
Thank you. Have you had any experience of someone coming to the ulcer with like an aggravated, like an escalated issue of it, like a very bad case of damages caused by ulcer? Or have you seen or have you heard?
Um, Based on as regards patients that have had one-on-one contact with, no. However, I mentioned that when I was doing my internship at the Lagos University Teaching Hospital, most times if I go review my own patient, I'll notice it was a common something that occurs commonly at the emergency unit, and adult comes in with this excruciating excruciating abdominal pain. They don't even want you to touch their abdomen. And then we do our investigation and we are like, it's a perforated peptic ulcer disease due to probably prolonged use of NSAIDs or, improperly treated peptic ulcer disease. I think I didn't rotate through the unit that treats ulcer. However, just by reason of interacting with my colleagues, I heard of maybe 2, 3 cases during my internship at LUT.
So just to give a shout out, because this webinar is in collaboration with Unilag, and Unilag is a University of Lagos, and we have a lot of students here. What advice would you give a student on how to prevent, how to manage, and how to treat if they've gone through the whole step, they've done the test for the H. pylori and everything? What would you advise to students of Unilag and all students out there on ulcer, on peptic ulcer?
I would like to take it from, I won't go straight to peptic ulcer disease. I would like to take it from dyspepsia. Dyspepsia is what most people have. And as I mentioned earlier, dyspepsia is that burning sensation, that feeling of bloatedness that a lot of people have in their upper abdomen. So if you're having dyspepsia and it's occurred over a long period of time, don't do what most people do, which is to use omeprazole, Gascol, just for symptomatic relief. Please come to the hospital so that it can be properly investigated and treated. Then, as I mentioned earlier, eight out of 10 cases of peptic ulcer disease is caused by Helicobacter pylori infection, and this infection is preventable by drinking safe water, by using safe water to cook, by good hygienic practices. So I would encourage these practices among students to prevent Helicobacter pylori infection, because as I said, prevention is always better than trying to treat something. Thank you.
Yes, and you keep mentioning H. pylori, H. pylori. This is a tough time. We have to buy food. And I know that, we have to be cautious about it. So is it only like majorly transmitted with water and food? Can you get it through any contact at all?
So as I said, it's majorly transmitted via contaminated food and water. Then also because the bacterial organism is in your stomach, it's found in stool. So you want to make sure that safe hygienic practices, safe wash your hands with soap and water after using the restroom. It's also transmitted by contact with saliva of people that have the infection. So as I mentioned, hygiene, and safe practices.
Okay, I have a question here, and I'm going to assume this person is a student. This person says they don't like eating in the morning and the afternoon, and by the time they eat dinner, they notice that after they eat, they have abdominal pain. Could this be ulcer?
Okay, as I mentioned, yes, it could be ulcer, but we need the confirmatory test to confirm that it is peptic ulcer disease. So, based on the history, I can't say it is. You need to come in for a proper investigation for us to be sure that it is peptic ulcer disease.
Okay, this same person is asking, how can I tell if it's stomach pain or if it's stress or if I'm just hungry? Because this person says they only eat in the night. I don't advise. I think the doctor will advise more.
Well, so of course, if you don't have a good diet, you're prone to have abdominal pain. So I can't exactly say what you're having, but what I would advise is a proper diet, breakfast, lunch, dinner, even if it's just little. It's good to have a good and proper diet. The fact that you are having pain at night when you are about to eat doesn't mean you have ulcer. Thank you.
Thank you so much, Dr. Jagede. And I think we're already coming to the end of this webinar. This has been really lovely, very informative. I as well have taken a few key points, and This was really nice to hear, and I hope someone out there that listens to this webinar, or if you're rewatching the recap of this after this, I hope you're able to get something. If you do think you have peptic ulcer, please come to KAAF Maternity. We're at Unilag, and you can ask for Dr. Jagade or any of our doctors, and they would assist you and answer all your questions. So, do you have any questions for us, Dr. Jagade?
I think lastly, I would want to, I think it's been a very nice interactive session. I want to say thank you to the University of Lagos and KAAF Medical Center for this platform to reach out with our community. And I believe this will have a positive impact on when I say community, I mean, our immediate pool of patients. I believe it would create a positive impact. And, I believe most of our audience today are students who might get to see a lot. So my take-home point is if you've been having dyspepsia, please come in, let's investigate properly and treat properly. Use safe water and safe food. Adopt good hygienic practices to avoid an H. pylori infection. Thank you very much for your time. Thank you.
Thank you so much, Dr. Jagede, for sharing your expertise with us today. Thank you to everyone who attended, and thank you to everyone here. There are some people here in the room, you can't see them. And we hope you found this webinar to be informative and helpful. And if you have any questions, please feel free to reach out to us. You can reach out to us on our Instagram, on our WhatsApp. I would answer you. My name is Fadira, and I'm the social media manager here. So if you have any questions, I would always answer you. So thank you. Have a nice day, everyone. Bye.